As oceans warm, their influence on global weather patterns grows stronger, sending pulses of heat and humidity inland that amplify urban temperatures and endanger millions of city dwellers. Cities, with their dense populations and concrete landscapes, are particularly vulnerable. The familiar phenomenon of the urban heat island, where asphalt and buildings trap heat, interacts dangerously with ocean-driven warming, creating conditions that can overwhelm human tolerance and urban infrastructure. For residents already at risk, the elderly, outdoor workers, children, people with chronic illnesses, the combined heat load from the ocean and city itself becomes a daily threat. In response, some urban centers are innovating strategies to protect populations, reduce mortality, and maintain public health in a climate increasingly shaped by the seas. One key approach is cooling infrastructure. Cities like Tokyo, Phoenix, and Barcelona are expanding the availability of air-conditioned public spaces, from libraries and transit stations to dedicated cooling centers during heat waves. Beyond temporary shelters, some cities are designing permanent climate-adapted buildings with high reflectivity materials, green roofs, and efficient ventilation to reduce indoor temperatures. Urban planning is increasingly incorporating shading and natural ventilation, recognizing that preventing heat accumulation at the human scale is as important as forecasting temperatures. Even small interventions, planting street trees, adding reflective coatings to playgrounds, installing shaded bus stops, can reduce local temperatures by several degrees, saving lives when extreme heat events coincide with peaks in humidity. Water management plays a dual role in reducing heat exposure and protecting health. Urban flooding risk often rises during ocean-driven heat events because warmer air holds more moisture, leading to heavier rainfall in short periods. Cities like Rotterdam and Singapore are integrating stormwater retention and permeable surfaces to reduce flooding while simultaneously cooling neighborhoods. Public fountains, splash pads, and green water channels serve both recreational and thermal regulation functions, allowing residents to lower body temperatures and reduce heat-related illness. Efficient water distribution ensures that vulnerable populations have access to drinking water during prolonged heat waves, which is critical for preventing dehydration, kidney stress, and heat stroke. Healthcare preparedness is another cornerstone of adaptation. Hospitals and clinics are retrofitted to withstand higher temperatures, ensuring that life-saving equipment, vaccines, and medications remain viable even during power outages. Mobile medical units are deployed to neighborhoods with limited infrastructure, and staff are trained to recognize heat-induced illnesses early. Emergency response systems are paired with real-time weather monitoring, often incorporating predictive models from oceanographers to anticipate heat peaks caused by sudden oceanic warming. This integration allows cities to mobilize resources, alert residents, and prioritize aid to the most vulnerable before conditions become critical. Community engagement is equally vital. Cities are fostering networks of volunteers and local organizations to identify and check on high-risk residents during heat waves. Awareness campaigns educate the public about hydration, cooling techniques, and early warning signs of heat stress. Digital platforms, apps, text alerts, and social media allow residents to receive timely guidance about when and where to seek refuge. In neighborhoods with limited air conditioning or elderly populations, such programs have prevented hospital overload and reduced heat-related mortality by providing practical, rapid interventions at the community level. Transportation and energy infrastructure are also being adapted. Mass transit systems, which often become dangerously hot in extreme conditions, are being equipped with climate control or adjusted schedules to protect commuters. Energy grids are strengthened to handle increased air conditioning demand during peak heat periods, often incorporating renewable sources to reduce additional emissions that would worsen the problem. Smart grid technology allows cities to anticipate and manage spikes in electricity use while minimizing outages that could endanger residents during critical heat events. Urban green spaces are being deployed not just for recreation, but as a public health buffer. Parks, urban forests, and vegetated corridors cool surrounding neighborhoods, reduce air pollution, and provide psychological relief from the stress of heat. These interventions also absorb stormwater and reduce flood risk, showing how multiple layers of climate adaptation can protect both physical and mental health. In addition, urban agriculture, rooftop gardens, vertical farms, and community plots help stabilize local food supplies during periods of heat and drought, reducing the nutritional stress that accompanies ocean-driven climate variability. Yet, even with these innovations, challenges remain. Vulnerable populations often live in neighborhoods with fewer trees, less access to cooling, and higher exposure to heat-absorbing surfaces. Social inequalities intersect with climate vulnerability. Low-income families, migrants, and residents in informal settlements are disproportionately affected. Effective adaptation requires integrating social equity into every urban planning decision, ensuring that cooling centers, water access, and healthcare reach those who need them most. Without this focus, even the most sophisticated strategies may leave the most at-risk residents exposed. Cities are also learning to incorporate ocean monitoring into urban planning. Rising sea temperatures, marine heat waves, and shifts in ocean currents influence not only coastal flooding but also the timing and intensity of heat waves inland. Some municipalities collaborate with oceanographers to forecast heat surges and coordinate preemptive measures, turning scientific insight into actionable public health interventions. Predictive analytics allow urban managers to anticipate extreme heat events days or weeks in advance, optimizing resource allocation, public warnings, and emergency staffing. The lesson emerging from global urban experience is clear: climate adaptation cannot be passive. Ocean-driven heat waves are already testing the limits of human resilience, and urban populations are the first to feel the compounded effects of water, air, and heat stress. Cities that proactively integrate infrastructure, healthcare, water management, green space, and community engagement are better positioned to protect their residents, maintain public health, and reduce mortality during extreme events. Conversely, cities that ignore these lessons risk repeated crises, overwhelmed hospitals, and a public increasingly exposed to preventable illness and death. In a world where the ocean's hidden warmth can return unpredictably, urban adaptation is no longer optional. It is an urgent public health imperative. The cities that succeed will be those that treat heat not just as a climate statistic, but as a daily challenge to life itself, designing systems that cool, protect, and sustain every resident, especially the most vulnerable.